Amazing Colorado. Thank you for bringing your blessings and your gifts and your talents and your energy to the State of Reform Conference, and thank you for coming here to change the world. We appreciate you. So I have the honor, Kim Bimsteffer, Hickpuff, good to see everybody. I have the honor of introducing a man who needs no introduction, but I'm going to give it a go. Governor Jared Polis is an entrepreneur, education leader, and dedicated public servant. As governor, he is focused on saving Coloradans money on health care and ensuring that every person can get the high-quality care they need when they need it. One of his first acts as governor, he created the Office of Saving People Money on Health Care, led by our Lieutenant Governor, Diane Primavera. And in the time since, the governor has signed bipartisan legislation to increase hospital transparency, to cut prescription drug costs, to cap the price of insulin, which have significantly reduced insurance rates, and established the landmark reinsurance program and Colorado Option, which have significantly reduced insurance rates on the individual market and given Coloradans more healthcare choices. Governor Jared Polis is focused on building a healthy, affordable Colorado now and for generations to come. And please help me welcome Governor Jared Polis.
Well, thank you, Kim, for your great work at Hickpuff. Appreciate you working with State of Reform. It's good to be here with you to really tell you a little bit about our work and goals and one of our most important topics, and that's saving people money on health care. That is our goal as an administration, and we look forward to continuing to work to deliver. Thank you for State of Reform for putting on this important annual event, bringing together leaders and stakeholders to learn from one another about how we can further reduce costs and expand access. Just a few weeks ago, we celebrated the launch of free new tools to shine light on the real cost of hospital care. One launched by a national nonprofit, one launched by Hickpuff. We long felt, of course, that market forces fail to work without full pricing transparency and competitiveness, and we're beginning to take action to really meaningfully apply market forces to the provider sector as they apply to so many other sectors with regards to being able to check and shop around and check prices for different procedures in a way that makes sense. This increased transparency is a key piece of the puzzle to help lower prices as we work to make sure that our competitive healthcare market provides high quality at a low cost. Cutting healthcare costs helps Coloradans hold on to more of their hard-earned money, improve our quality of life, and makes our state more affordable. We're proud that we were the first state to cap insulin costs at $100. Many families had to pay hundreds or even thousands of dollars before that. We passed the bipartisan reassurance initiative that Kim mentioned to drive down premiums 20, 30, even 40% in parts of our state. In the exchange, the most price-sensitive group about who will determine whether they have coverage or not. In fact, next year, the landmark reinsurance initiative will save Coloradans $493 million on health care premiums. We also know that people, and not just Coloradans, but across our country, are tired and getting ripped off on the high cost of prescription drugs, where we pay sometimes 5, 8, 10 times as much for the exact same prescription drug available in other wealthy countries at a fraction of the cost. That's why we established a Prescription Drug Affordability Board in partnership with the legislature. We submitted a historic Canadian drug importation plan to save consumers and employers an average of 60% on prescription drug costs. Once approved and fully implemented, we expect Coloradans to save over $50 million over 3 years. And we continue to call on the FDA, and our application resides there, along with Florida's, to approve our drug importation plan so we can move forward and deliver real savings to Coloradans, making it more affordable to get the prescriptions that people need to be healthy and thrive. I would add, at lower prescription costs, you also have higher compliance and better health outcomes for those who rely on prescription drugs. We also continue to make bold and innovative investments to support our workforce in Colorado. I was proud to sign a bipartisan law to create Colorado's third medical school and second public medical school at UNC in Greeley, a partnership working with UNC, MSU Denver, and CSU, and Trinidad State will also, in addition to doctors at the medical school, will train more nurses, veterinarians, and allied health professionals across these important institutions. And through Care Forward Colorado, aspiring healthcare professionals receive zero-cost training at every Colorado college and community college. In the first 2 years, over 9,000 students got training through Care Forward, filling jobs like certified nursing assistants, emergency medical responders, medical assistants, phlebotomists, and more. And by removing cost as a barrier, we increase enrollment by about 1/3 in these kinds of opportunities and careers that lead to jobs, and also the potential for upward mobility if people choose to advance in their health-related professions. I met one young man who was one of the first students to participate in Care Forward, who was training to be an EMT, say that with the money he saved on his tuition, he was able to repair his car to get to class. And that's the difference that it makes in access. That's just one example of the savings students are seeing while getting the skills they need to fill good jobs tomorrow and launch meaningful careers, as well as begin the next chapter of their lives debt-free. We know that there's more work ahead to cut costs, to make quality healthcare more available, to bolster our healthcare workforce and make sure that people from all different backgrounds can tap into the many great opportunities that the healthcare sector provides. In Colorado, we know that when we come together and innovate, we can truly tackle even the most complicated challenges, which is why gatherings like this are so important. We look forward to helping to write the next chapter and saving people money with you. I want to thank you for your commitment to this important work. Thank you.